Hey, you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before starting with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, courses, review books, and videos to assist nurses as well as nurse practitioners with success on boards as well as in practice. I have been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, and I would love to assist you if you need it. Now, I always give the disclaimer, the reminder that we know that there's no absolutes in medicine, right? We treat on a patient by patient basis. And any of the questions that you see, I have created based on the guidelines that are currently being tested on the ANCC as well as AANP exam. Now, if you see any of my videos, if I'm teaching on something that we currently do in practice, I will always say that so there's no confusion. But with that being said, let's get into question number one for today. Question number one states the patient presents to the office today with complaints of itchy, watery eyes. She states that her eyes keep watering up. Upon examination, the nurse practitioner notes a stringy rope like discharge coming from the patient's eyes. Based on these findings, how should the nurse practitioner diagnose? Is it A, viral conjunctivitis, B, allergic conjunctivitis, C, bacterial conjunctivitis, or D, blepharitis? Take a moment and tell me what you got in the comments, you guys. All right, you guys. So, I always recommend reading the stem of the question first. Stem being that last sentence, typically the actual question in the entire scenario, so that you can slow down and ensure you're answering what is being asked. So, here the stem of the question states based on these findings, how should the nurse practitioner diagnose? Right? And I tell you, if it's asking for a diagnosis, we have to run it back and look at the assessment findings, right? How are they presenting? What are we looking for when we think of assessment? The signs, the symptoms, the subjective, the objective, and any of the findings that we do in our full assessment, right? So here it states the patient came into the office complaining of itchy, watery eyes. So we're starting to think of potential diagnoses and causes of itchy and watery eyes, right? Picture, as they're telling you all of the things, picture this person in front of you. Um, and it also states that she says her eyes continue to water up. The nurse practitioner notes stringy rope-like discharge coming from the patient's eyes. And I always talk about those key identifiers. If it's a classic key identifier, make sure you know it. When I say this, you say that. You know my sayings. And so, if it says stringy, ropey, rope-like discharge, you should think allergic conjunctivitis, right? Itchiness, watery eyes, stringy discharge, rope-like discharge, or ropey discharge, all classic presentation for allergic conjunctivitis, okay? And just think about it. Think about allergies and how your eyes itch or your nose may itch. The classic things. Your eyes are watering up. It's allergic conjunctivitis, okay? So make sure y'all know the differences and things on that. Question number two, the nurse practitioner has diagnosed the patient with syphilis. How should the nurse practitioner treat? Is it A, flagyl, B, Bactrim, C, penicillin G, or D, Rocephin? Take a moment and tell me what you got in the comments. All right, so stem of the question states, how should the nurse practitioner treat? Same thing. If they're asking for a treatment, you need to run it back and see what diagnosis we have. Have they provided you with the diagnosis? And if not, then you need to run back a little bit further and look at the assessment so you can come up with the diagnosis to know how to treat. Because we have to have a diagnosis to treat, right? We got to know something. What are we treating? So uh, it states they have provided, the diagnosis here. It states that the nurse practitioner has diagnosed the patient with syphilis. So this is a knowledge-based question. What do we treat syphilis with? The answer is C, penicillin G. Penicillin G is the treatment for syphilis, okay? And then lastly for today, question number three. A patient presents to the office with complaints of yellow discharge. Upon examination, the nurse practitioner notes a strawberry cervix. Based on these findings, how should the nurse practitioner treat? Is it A, flagyl, B, Rocephin, C, penicillin G, or D, Bactrim? Take a moment and tell me what you got in the comments. All right, so the stem of the question states, based on these findings, how should the nurse practitioner treat? All right, like I just told you on the last question, if they're asking for a treatment, you need to look and see if they have given you a diagnosis. And if not, then we have to figure out the diagnosis. And in order to figure out the diagnosis, we need to run it back and look at the assessment findings to come up with the diagnosis, to then come up with the treatment, right? So we're going in reverse, right? We're working backwards. So they don't provide us with a diagnosis here. So let's see the assessment findings and the presentation, right? So the patient comes in complaining of yellow discharge. The nurse practitioner does an exam and notes a strawberry cervix. All right, you guys. So these are classic identifiers, classic presentation of right? Trichomonas. So again, if I say yellow discharge or strawberry cervix, you should say trichomonas, right? And so then now that you have come to that step, then you need to be able to say, how do we treat trichomonas? And the best answer is A, flagell. Now, this, I want to give y'all some information because a lot of the one-on-one sessions when I'm doing things and we're structuring your studies and we're looking at things like, when you get the form back that tells you where you were strong, where you were weak, where you were low, high, etc. And it's broken down and it may say assessment, it may say, planning, implementation, evaluation, all of the things. This is how they do it. I think that when y'all are reviewing, you look at it and you just say, oh, well, it only asked me for a treatment, right? So how is that gauging all of these things, right? You just think, oh, I know how to treat. But this is assessing so many levels because in order to come up with the treatment, you had to be able to understand assessment findings. You had to understand the diagnosis and differentials, right? And then you were able to come up with the treatment. So this can score you on assessment, diagnosis, and treatment all together. This is giving you 3 different things just by answering this alone. So when you're studying, I want you to walk through all of those things to make sure you have the full understanding and pay attention to the route that they're taking you. And if you notice, anytime that I'm teaching it on these videos, as I work through practice questions with you guys, if you have my review book, if you have in my courses, this is the way we work through it, right? Because I'm telling you, this is what they're testing you on. Because this is how we practice. This is how we document in SOAP notes, right? It's all the same scenario. So you need to learn to train your mind that way. Okay, we assess our patients, right? As soon as the encounter starts, we're already assessing the patient based off of what they're telling us, based off of what we're seeing, their demeanor, all of the things. So when they start the scenario and they're telling you all these things, you start to formulate your mind just like this person is in front of you. Assessment, diagnosis, evaluation, treatment. And that's what they're gauging. So pay attention to that. As you work through and study, just do that. And I know I say it all the time, but I just want to make sure that you're seeing what I mean by it and getting it together. And that's what people who work with me one-on-one know that I talk about, because it's like, what am I doing differently with you guys? But that's what it is. It's just filling that gap. That's my common practice. I fill the gap because y'all just need to know how to switch it to that. And so you study it and you know it, but that little small piece of directing it to the application of how the test may deliver, just that light bulb is most commonly the issue. It's not always the knowledge deficit. So I'm trying to get y'all to see how to shift your mind when you're studying and reviewing. Okay. So I know when I get on my soapbox about assessment, diagnosis, evaluation, treatment, you're probably like, here she goes again. But this is why. Trust me. Okay. Just do that as you review, as you work through any of the material. Just look at it in that fashion so that you can get it. When these questions are broken down, even when I'm having you to work backwards based off of what the STEM is saying, it's still through those process and steps and procedures, right? So just try to think of it in that fashion as you review and practice that as you do the questions. And I'm hoping that this is helping you as y'all do these questions with me each day to kind of train your mind to focus in this from this standpoint. But all right, y'all. I know I'm ranting, but I hope you found it helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure y'all meet me back here. If you need any of the resources from the Nursing Studio, give us a call at 803-400-6864. You can also shoot us a text to this number or shoot us an email to the nursing studio, the number one at gmail.com. Uh, as mentioned, we have the review book. With my review book is the ebook option and a paperback option that can be shipped to you. Of course, with the ebook, once purchased, you have it available instantly on any device that you utilize. Both of those are linked in the bio of this channel. Also, I offer a self-paced review course for family nurse practitioners and adult gero. It is designed for AANP as well as ANCC. It is broken down by systems with many quizzes with it, and you can watch it as many times as you like. That is also linked in the bio of this channel. Now, again, that is self-paced, so you do this on your own and review. But it's me teaching through the videos, using my Brittany's Brilliance and mnemonics to kind of help you tie it together, short and sweet fashion, to study on the go. Then we have our 5-week course that starts on June the 10th. That is linked. You can even see it on the post in this on the channel. And then lastly are the one-on-one sessions. So, one-on-one, I always say just give us a call, shoot us a text, or shoot us an email, because it is customized based off of your needs, be it that you're looking for exam readiness, or if you are wanting to work through a weak area, you're struggling with asthma, you want to just spend time on that, or the more common one is the custom packages, like, hey, I'm trying to prepare for boards, had an unsuccessful attempt, trying to see what I need to change. And we formulate this. I work with you, we gauge where you are, what the weaknesses are, structure a study plan based off of that, and then work alongside with you during that period of time that you want to allot to it. And then we have one-on-one sessions throughout as well, where we meet and then get you ready so that you can be successful. But if that's anything that you may need, just contact us and we'll get you all set up. But as always, y'all make sure y'all meet me back here. Happy studying. Bye, y'all.